Have you ever thought about this? You have a critical doctor's appointment, but you literally have no way to get there. For millions of people, that's not just some thought experiment, it's their reality. Today, we're going to pull back the curtain on a service designed to fix this exact problem: non-emergency medical transportation, or NEMT. And trust me, whether you're a patient, a caregiver, or you work in a healthcare facility, this system affects you in a big way. So here's our game plan. First, we'll tackle the transportation barrier itself. Then, we'll get into what NEMT actually is. We'll follow the money to see how it's funded, look at the scheduling headaches it can create, and then, the big one, we'll assess its real impact. And finally, we'll boil it all down to the key things you really need to know. Let's get into it.
All right, let's start at square one. Why do we even need something like NEMT in the first place? Well, it all boils down to a fundamental, critical breakdown in a person's healthcare journey.
You got to ask yourself this question, and the answer, most of the time, has nothing to do with a patient forgetting or not wanting to go. For millions, the single biggest hurdle is just getting from their front door to the clinic. Transportation is one of those invisible walls that can completely derail consistent medical care. And the sheer scale of this problem, it is absolutely staggering. We're talking more than 21% of adults who don't have a car or easy access to public transit have had to skip or put off medical care. That's not just a small inconvenience, right? That is a massive gap in our healthcare system. So how do we fix that? How do we build a bridge over that gap?
Well, that's exactly where non-emergency medical transportation is supposed to come in. Let's take a look at the system that was designed to be the solution.
Okay, so at its heart, NEMT is pretty simple. It's a transportation benefit to get people to and from their medical appointments. And that could be anything: primary care, dialysis, even just a quick trip to the pharmacy. But here's the crucial part. For anyone on Medicaid, this is not an optional perk. It's a federally required benefit. So while NEMT is a total cornerstone of Medicaid, you're also seeing it pop up way more in the private insurance world, especially with Medicare Advantage plans. Get this, over a third of all MA plans now offer some kind of transport benefit. And for special needs plans, which are for members with chronic conditions, that number just skyrockets to nearly 90%. So we know who's covered, but let's do what they always say: follow the money. Because understanding how this stuff gets paid for is key. It really shows the two completely different worlds that NEMT providers have to live in.
Now, it's really important to draw a clear line here between NEMT and what traditional Medicare covers. Original Medicare Part B, yeah, it'll cover an ambulance in an emergency. It might even cover one in a non-emergency, but only if it's considered medically necessary, like you need a nurse to monitor you during the ride. It's not going to cover a simple car ride to your regular checkup.
Okay, let's shift gears a little. Let's look at the operations, because this whole system can turn into a massive logistical puzzle, especially for the people inside the healthcare facilities who are trying to coordinate all these rides.
You know, if you're a care coordinator or a discharge planner, this slide probably looks like your worst nightmare. The old-school manual way of scheduling NEMT is just a mess. It's endless phone tag, emails, faxes. This huge administrative burden leads to mistakes. You have zero idea where the ride is in real time, and worst of all, it leads to delays that keep patients waiting and hospital beds full. But here's the good news. Modern tech is totally changing the game. These new software platforms are taking that manual chaos and turning it into a super clean, automated workflow. A ride can be scheduled in literally 60 seconds, sent out to a whole network of drivers, and then tracked in real time by everyone. It's all about swapping that friction for pure efficiency. So we've got this whole system. It's designed to solve a very clear problem, and technology is making it better.
There's one area where the evidence is crystal clear: the patient experience. NEMT has a massive positive impact here. People feel more satisfied, less stressed, and like they have more control over their own healthcare. So even while the hard financial and clinical data is still developing, the social benefit is undeniable.
Okay, let's bring it all home and make this super practical. What should you, as a patient or as a provider, take away from all of this?
All right, if you're a patient or a caregiver, listen up. Know your benefits. If you're on Medicaid, NEMT is guaranteed, period. If you have a Medicare Advantage plan, dig into your policy. You might be surprised at what you find. The best thing to do is call your plan administrator, ask about your options, and hey, even ask if modern rideshare services are part of the deal.
And for all the folks working in healthcare facilities, the message is just as clear. The old way of doing things is just not cutting it anymore. It's inefficient and it's frustrating for everyone.
Moving to a digital platform can slash that admin time, cut down on errors, and get your patients where they need to go on time. That means better patient flow, faster discharges, and ultimately, better care.
And all this really brings us to the future, doesn't it? As technology gets better and companies like Uber and Lyft get more involved, NEMT is changing fast. The big question isn't just how do we provide a ride anymore, it's how do we seamlessly weave transportation into the very fabric of patient care? How do we turn it from a logistical headache into a core part of keeping people healthy? Thanks for watching.